Moving to the next segment, we first divide the back into several work zones and uncover it. Back massage must include treatment of the upper bundles of the gluteal muscles. During the leg massage, we work the lower two-thirds of the glutes. The remaining upper third is part of the back routine. We divide the back into several anatomical regions, the first being the sacral area. This area covers the upper glutes, followed by the lumbar zone. We work the lumbar region up to the mid-thoracic section, then move to the upper structures. This segment includes the interscapular area, transitioning into the shoulder girdle and arms. We pay special attention to the zones that are most often the source of pain for patients. The most problematic areas include the lumbosacral region and the interscapular area. Detailed work is also required for the upper trapezius, the C7 vertebra zone, and the shoulders. These specific areas deserve extra time for deep and high-quality manual impact. The therapist's starting position for the back massage is at the head of the table, facing the client. This position is ideal for even oil application and performing basic techniques. During the session, we will periodically move to the side of the table for specific manipulation. However, for most of the back massage, the specialist works effectively from the head position. We begin by applying oil using 3 full pumps of the dispenser for the entire back surface. Spreading the oil in our palms, we place them on the sacral zone and glide smoothly upward. Reaching the upper trapezius at the base of the neck, we move hands over the shoulder blades and down the shoulders. We return to the lower back along the same path, increasing the area and density of palm contact. If the first touch was light, the return stroke should be as firm as possible against the body. Distribute the oil evenly over the entire surface using broad fan-like palm movements. Thoroughly work the sides of the back, ensuring a smooth hand glide over the entire work area. When distributing oil, we also include the lower part of the cervical region. Use the finger pads to apply the massage product more precisely to the neck and collar area. Finish the preparation with a soft stripping motion downward, covering the entire back and arms. Three pumps of a standard oil dispenser are usually enough to cover the entire upper body. Now that the back and arms are evenly covered in oil, we are ready for the next stage, friction. Friction starts from the sacral zone and is performed upward toward the shoulder girdle and trapezius. The main focus of friction is in the paravertebral zone along the spinal extensor muscles. I try to avoid intense friction directly over the ribs due to their high sensitivity. Sharp movements over the intercostal spaces can cause discomfort or ticklishness for the patient. We will work this sensitive zone later using other gentler manual techniques. During friction, the main pressure is on the pads of 4 fingers, especially in the sacrum. Perform short rhythmic movements where one hand moves up and the other moves down. Perform 5 to 6 friction strokes in one local area, then gradually shift upwards. For quality friction of the upper trapezius, I recommend adopting a lower stance at the table. Changing the body's position allows the therapist's hands to reach the very top of the trapezius. After finishing this zone, we smoothly return to the starting position. Then we proceed to perform a general stroke over the entire working surface of the back. This technique integrates all the zones where the massage oil was previously applied. After stroking, we return to the sacral zone for the next stage of friction. At this stage, we transition the palms into a soft, relaxed fist position to increase the impact. Keep the hands relaxed and perform rhythmic friction similar to the previous technique. The only difference is that now we work with the surface of soft fists instead of the flat palm. Begin the dynamic movement from the sacral area, gradually advancing along the spine. Fist work at this stage is performed lightly and does not require significant physical effort. Efficiency is achieved through correct technique, not excessive muscle. The main contact with the body is made with the dorsal surface of the bent finger phalanges. Upon reaching the cervical region, in the C7 vertebra area, the fists rotate at a 45-degree angle to the spinal axis. Here we perform specific friction strippings for deep tissue decompression. Finish the cycle with a long longitudinal stripping and a general soothing stroke. When working with larger patients, the fist friction technique should be modified. Instead of small movements, we fix the fist in one position and perform deep linear friction. Linear friction in this case is firmer and allows for penetration into the deep layers. This option is ideal for working with bulky muscles where standard techniques may be less effective. Forceful fist impact ensures quality kneading even with a massive muscle layer. To enhance the impulse, engage the simultaneous rotation of the shoulder girdle and torso. Perform the deep movement with your entire body mass, ensuring stable pressure on the tissues. Finish the power technique with a final stripping and a soft stroke over the entire back surface. We have just finished the first stage, including general soft and deeper fist friction. In the next stage, we will move to detailed work on the upper glutes and the sacral zone. We begin working this area using the short thumb stripping technique. Place your hands securely on the gluteal muscle, fixing the hands to create a working support. Transfer your body weight onto the working surface and perform a series of rhythmic short strippings. We move steadily through the center of the sacrum, advancing toward the border of the lumbar spine. Upon reaching the projection of the spinous processes, stop the movement and smoothly return to the starting point. Repeat the cycle 2 or 3 times, reinforcing the. Finish the local work with a series of 2 or 3 long, extended palm strippings. Perform a final stroke over the entire surface of the tree. Now we move to working the lateral part of the sacral zone along a triangular path. This area is the attachment site for the powerful muscle fibers of the gluteal group. Painful spasmed areas often localize at these muscle-to-bone attachment points. Special attention must be given to these attachment points during deep tissue massage. We begin additional detailed work on the lateral surface of the sacrum. Reuse the short thumb stripping technique along the muscle attachment line. Thoroughly work the remaining muscle volume on one side to achieve tissue relaxation. After finger work, it is necessary to perform intensive stripping of the entire muscle group. We lead the stripping from the attachment point on the sacrum toward the lateral thigh. Superficial impact in this zone will be ineffective and suitable only for regular stroking. For deep compression, place one palm on the sacrum and firmly cover the working fingers with the other. Your fingertips should be directly over the projection of the sacrum bone. During the movement, the fingers pass through the attachment points and descend along the gluteal fibers. Fix the reinforced hand position and perform a very smooth and deep stripping glide. The lead role in the movement belongs to the upper hand, while the lower palm remains relaxed. Make the pass as smooth as possible, putting your entire body weight into the upper hand. Advance the hand until it naturally slides off, then return to the starting point. Repeat this power technique 3 to 6 times to achieve deep tissue decompression. Using this technique allowed us to effectively relieve superficial tension from the upper glutes. Now we can much more easily detect local knots and spasms using our thumbs. During palpation, I identify a pronounced spasm directly at the muscle attachment point. No other pathological knots were found in this area during the examination. This trigger point is critical because it often goes unnoticed during leg massage. When working from the lower limbs, this deep knot in the upper third of the glute is barely felt. However, from the back, we gain direct access to the muscle attachment points on the sacrum. We proceed to targeted spasm deactivation as it is localized in this area. I locate the tight muscle, not perform deep pressure, and fix my finger on this point. To create stable pressure, I use the thumb of one hand reinforced by pressure from the other. As the muscles relax, my fingers begin to glide smoothly to the side, then we return. I choose a position where the hands won't slip and can sink deep into the tissues. To do this, I shift slightly at the table to comfortably transfer my body weight into the deep compression. Perform a smooth press and hold your fingers working with the soft pads. It is important to avoid pressing with fingertips where the nail edge might be involved. Such actions can be painful for the client and hazardous to the skin. Deep compression must be done exclusively with the soft part of your finger phalanges. In addition to static pressure, you can apply a stripping technique by positioning the hands. For this, we point the thumbs downward, preparing them for the working movement. Find the muscle attachment line, place your fingers on it, and perform a deep stripping movement to the side. This technique allows for effective treatment of all identified tight areas and trigger points. In this position, it is very convenient for me to transfer my... This technique is as deep as possible and provides a pronounced therapeutic result. Perform a firm compression. And perform a smooth, rolling movement with your fingers to the side. Where specific spasm foci are found, I can pause for more detailed work. When the muscle begins to relax, the fingers start sliding slowly across the surface on their own. Finish the stage with stroking if your hands are tired or the client is large. Use the forearm. Using the forearm allows for deep compression without excessive strain on the wrists. You can use the arm that is closer to the massage table and the client. Act carefully. If the elbow slips, you risk losing balance and leaning too hard on the person. Therefore, perform stripping with the near arm very cautiously and under full control. Never rest your wrist on the sacrum area, as there is almost no muscle layer there. Direct pressure on the bone will be very painful and hazardous for any client. The arm should be placed only on soft tissues, attachment points, and the muscle mass itself. Similar manipulations can also be performed. In this position, working with the forearm often turns out to be much more convenient and ergonomic. Position the forearm and perform smooth, deep stripping downward and outward. Be careful upon reaching the hip joint. You must completely release the forearm pressure. We work exclusively on the soft structures of the gluteal muscles, avoiding the bony protrusions. Perform local stroking and be sure to include percussion tapping on the muscles. Perform a series of soothing, smoothing strokes in the gluteal area. After this, move to a broad, unifying stroke over the entire back surface. Gently lower your hands, maintaining continuous tactile contact. Move to the opposite side of the sacral zone, where we will work on the same area. First, we need to thoroughly work this area using our thumbs. Note that alternating thumb stripping is not always enough for clients with a larger body. If the client is large, use the reinforcement technique by placing your palm over the working thumb. Place the thumb, press it firmly with your palm, and perform a deep stripping movement. Repeat the technique, concentrating your torso's weight into the work zone. You can use either hand for reinforcement based on what is comfortable in your current position. This is a universal method. Cover the thumb with the palm. The technique is simple to execute, yet it provides the deepest possible tissue impact. After thoroughly working the zone, move to the glutes, placing 4 fingers on the sacrum. Press the working hand with your other hand and perform a smooth lateral tissue shift. The result is a deep circular movement with intense additional pressure. Next, begin searching for tight areas using your thumbs, working very systematically. We avoid chaotic movements and work through every inch of the surface in detail. Every section of this segment must be deeply pressed to identify hidden spasms. On this side of the buttocks, no pronounced muscle knots were found during palpation. Therefore, we will not apply additional forceful forearm stripping here. Excessive intense impact is not required when spasms are absent. Perform local stroking, then move on to a general smoothing of the back. Include the neck area in the movement and smoothly return to unifying passes. This concludes the detailed work of the first part of our program. We have finished working the upper glutes and are moving to the next stage of the back massage. Our goal will be the sequential treatment of the right and left lateral sides of the back. We need to warm up these zones and perform a deep massage while standing at the side of the table. The first technique we will apply in this position is direct forefinger stripping. Start the movement from the spinal extensors, performing soft, alternating strippings with each hand. Try to maintain rhythm and smoothness in your movements. In the rib area, the movement changes slightly. One hand glides over the ribs in an oblique direction. The second hand, meanwhile, performs a linear stripping stroke along the entire surface. We move higher to the scapular area where the muscle fibers are arranged in a fan shape. With one hand, we strip upward toward the shoulder, with the other from the upper edge toward the joint. Using this combined method, we thoroughly work the entire scapular projection. Spend a bit more time on this zone, lingering on the tissues around the shoulder blade. Here we engage the trapezius and latissimus dorsi muscles. After treatment, smoothly descend with a soft stroking motion along the entire side of the back. The next element of our program will be spiral kneading movements. The main focus here is on grasping and firmly pressing the soft tissues with the heel of the palm. Perform rhythmic semicircular rotations, repeating a couple of times on each section and shifting forward. Our task is to effectively shift the skin muscle mass, providing superficial and medium muscle work. Upon reaching the scapular area, we pause again for a more detailed impact. After completing the kneading, return to the lumbar zone with a soft gliding movement. The third technique in this cycle is short displacements of the long spinal extensor muscles. Place your fingers in the gap between the spinous processes and the paravertebral muscle ridge. Locate the vertebral edge, sink your fingers into the muscle tissue, and gently push it aside. After shifting, perform a small spiral rotation and reset your fingers slightly higher. It is vital to avoid sudden finger slips on the skin surface while performing this technique. You must first go deep into the tissue, fix your fingers, and only then smoothly shift the muscle ridge. In this way, we create a light muscle stretch, then slightly release the hand pressure. Perform a soft circular movement and return to work, placing fingers on the next segment above. It is very important not to allow abrupt finger slipping during this impact. First, sink into the tissue, fix the position, and only then smoothly push the muscle ridge aside. We create a light fiber stretch, then slightly release the finger pressure. Perform a circular movement and return to work, placing the hands slightly higher along the muscle line. To conclude the cycle, smoothly descend to the lumbar zone with a soft stroking movement. This is the basic set of 3 massage techniques for working the lateral surface of the back. When working with larger clients, these techniques can be modified for better results. Direct strippings are universal and easily performed on patients of any body type. If circular kneading feels ineffective, use the palm-on-palm reinforcement technique. In this position, the pressure is concentrated under one palm, which significantly increases the force. By combining hand efforts, you can perform deep circular rotations to shift the muscle mass. This approach makes the technique twice as powerful for your client, compared to working with both hands separately. Moving on to the next element, based on the principle of lateral displacement. If finger movements are difficult, you can again use hand-on-hand reinforcement, ensuring a much deeper and stronger impact than with a standard grip. Another variation for short displacements is using the heel or the corner of the palm. Position the hand, stabilizing it from above with the second palm to prevent slipping, and begin. At this moment, I clearly feel the entire muscle volume of the treated area. Using the heel of the palm, I effectively shift the muscle layers relative to each other. Perform a smoothing stroke. These three techniques and their variations allow for a high-quality warm-up. Let's consider additional treatment options, as clients often complain specifically about this area. Lumbar hypertonicity and shortened muscle fibers are frequently observed in these sections. Sometimes this is visible even to the naked eye as body asymmetry when examining a lying patient. This condition can manifest as uneven pelvis or shoulder height due to muscle knots. During deep massage, this tissue rigidity becomes very palpable since many muscles overlap. Most often, the quadratus lumborum running from the lower rib to the pelvis is involved. To treat it effectively, we need to include specific manual techniques in the session. After performing the three basic movements I showed, we proceed to focused work on this zone. Let's break down the mechanics for performing additional deep decompression of this muscle group. Using the thumb, I repeat the sliding movements we used earlier in the gluteal region. I place the thumb exactly on the spinal extensor ridge and perform a lateral glide. Position the thumb on the extensors and smoothly shift the tissue outward toward the side of the torso. Note that I use almost no physical force from the hand or forearm itself. The main pressure is created by transferring my torso weight and using my overall body mass. The key requirement is smoothness. You must tactily feel the depth of compression, avoid abrupt slips, maintaining stable and deep contact throughout the entire pass. Ensure that the pressure does not shift onto the ribs, as such compressions are not performed on bone. Fix the position, sink into the tissue, and perform a smooth, deep press. Next, we palpate the iliac crest of the pelvis, where the core stabilizing muscles attach. These structures are responsible for spinal stabilization and proper body alignment. Working along this line is mandatory, using the reinforcement technique if necessary. Position both hands with thumbs pointing down and thoroughly work the entire iliac crest. Smoothly follow the bony landmarks and shift slightly higher to work directly on the muscles. Perform a gentle stroke. Remember that intense percussion is not used in this zone right now. If the deep massage caused pain for the client, replace striking techniques with gentler ones. In such cases, we use light vibration combined with soothing tissue stroking. You can also apply a deep stripping technique to create a pronounced muscle stretching effect. We begin the movement from the rib line, using the working surface between the fingers to grip and sink in. Firmly grip the tissue and perform a steady stripping movement in a descending direction. Let your hands down to the pelvic area and upper glutes, repeating the technique with both hands. To increase pressure in this zone, you can use the palm-over-palm reinforcement technique. Similar strippings toward the thoracic region are allowed, but there are anatomical limits. Upon reaching the ribs, avoid excessively deep or hard impact due to the high sensitivity of the area. Intense manipulations over the ribs can cause the client unnecessary discomfort or pain. Therefore, in this region, we perform strippings, more gently finishing with a smoothing stroke. Now we move to the second half of the back, maintaining symmetry and the sequence of techniques. We repeat the entire protocol, and if knots are found, perform additional treatment of the area. Start the work with a series of linear strippings over the entire surface of the selected back segment. While working on this side, I tactily identify a local tightness in the muscle structures. The extensor muscles in this area are in a state of pronounced hypertonicity. I am marking this spot to return for a detailed, deep treatment a bit later. After intense impact, perform a general stroke in an upward direction from bottom to top. Smoothly pass your palms up to the shoulder girdle and arms, then gently return to the start. There is another stroking variation that is especially effective. These are deep enveloping strokes, which we finish by returning the hands along the midline. To make the technique tactily pleasant, it must be performed with high quality and firm contact. Avoid superficial touches. The stroke should be volumetric and cover the entire muscle mass. Lower your hands as far as possible, almost touching the surface of the massage table with your palms. This coverage creates a pronounced soothing effect and provides the client with a pleasant sensation. The next technique is aimed at deep, detailed work on the extensor muscles along the spinal line. We work on each side sequentially, starting with palm stripping techniques. Place the heel of the palm in the lumbar region at the beginning of the spinal muscle ridge. Perform a slow stripping movement, advancing upward and finishing the pass in the shoulder area. The second hand duplicates this movement, creating a continuous wave of impact on the muscle structures. This results in rhythmic alternating stripping that deeply prepares the tissues. This stage is preliminary before moving on to more intensive manual manipulations. We ensure high-quality warming of the entire paravertebral zone. To increase the depth of the impact, we switch to using the thumb technique. Place the thumb at the lower border of the sacrum, preparing it for a powerful pass. Cover the working thumb with the palm of the other hand and perform a smooth stripping along the extensors. Continue the compression as long as your ergonomics allow you to effectively transfer body weight. Upon reaching a certain point, the tilt angle changes and focus pressure becomes less effective. We will work this upper zone in detail a bit later using techniques more suitable for it. Based on the client's build, lead the stripping movement roughly to the upper edge of the scapula. Having reached this boundary, smoothly lower your hands through a soft, soothing stroke. Reset the thumb to the starting point and repeat the deep stripping cycle 6 to 8 times. This is a key movement, allowing for high-quality work on the long spinal muscles. Thanks to the firm contact, I can tactily identify any residual knots in the muscle ridge. With the tip of my finger, I clearly feel all deep tightness requiring targeted attention. We focused on the lower back, but in the process, I found hypertonicity. There is a fairly pronounced tightness in the area where the trapezius muscle begins to attach. To eliminate this spasm, we will need to perform a series of additional manual manipulations. In this local zone, I apply the technique of alternating short finger pad strippings. If one-hand strength is not enough, use the thumb with mandatory reinforcement from the second hand. Perform short and deep strippings exactly in the spasm zone, achieving gradual tissue relaxation. A sign of effectiveness will be the appearance of a slight redness, hyperemia, in this area. If finger strength is lacking, you can successfully replace them by working with soft fists. Use alternating fist strippings, maintaining a steady rhythm and depth of tissue immersion. Set the fist firmly, put your body weight into it, and perform a smooth compression of the problem zone. Choose the most anatomically advantageous hand position to ensure the correct. Each hand should move along its own trajectory, ensuring maximum comfort and effectiveness. When a local knot is found in this section, I perform a series of focused compressions. Thoroughly work the trigger zone without losing control over the impact depth. After completing the cycle, perform a soft stroke, unifying the treated area with surrounding tissues. If deep finger work is difficult, the forearm stripping technique can be used. Remember safety. We work with the soft surface of the forearm, completely excluding sharp elbow pressure. Finish the impact in this area with a soothing stroke. After intensive deep work, be sure to perform light vibrational movements. Make a broad unifying stroke over the entire back surface. Move to the opposite side, performing an intermediate stroke at the head of the table. Perform an additional pass to maintain continuous tactile contact with the client. Always maintain contact with one hand on the patient's back while moving. Begin alternating linear palm strippings working on the new side of the back. Next, move to deep thumb compression using palm reinforcement. When working with larger clients, the sequence of techniques can be changed for greater efficiency. If thumb pressure is insufficient, it is advisable to start the treatment with fist work. Perform a preliminary alternating soft fist stripping along the muscle ridge. Working with fists after palm strippings prepares the muscles perfectly for deeper work. This technique allows the therapist to easily transfer their body weight into the working surface. After the power compression, perform a stroke and move to focus stripping. Set the thumb, cover it with the palm, and perform a smooth upward movement. At this moment, under the pad of my finger, I clearly identify areas of pronounced hypertonicity. A well-executed diagnostic pass allows for precise determination. In this segment, the muscle fibers feel significantly thickened and rigid. Perform 5 to 8 general stripping passes along the entire length of the extensors. After the stroke, begin detailed and deep work on the identified problem zone. I use the simultaneous two-finger pressure technique, working with a small amplitude. Start with short strippings without trying to cover the entire length of the muscle belly at once. If necessary, you can work with one finger with reinforcement, concentrating on the local knot. Perform short and focused strippings to achieve deep tissue decompression. Complete this local cycle with a soft, soothing stroke. During palpation, I noticed that the lateral part of the lumbar region is also very tight. The muscles here have completely lost elasticity and feel very rigid when pressed.
Наступить. Здесь мы проходили по центральной линии, разъебателя ему немножко сместиться, примерно на линию крепления в квадратной мышце поясницы, и с нее начать.
During the movement, I am finding an additional active trigger point. In this tight spot, you can pause to perform deep ischemic compression. Complete the pass and smoothly move further along the muscle fiber. I will show you another effective technique for working on a tight lumbar region. This method is indispensable when the main issue is localized in the quadratus lumborum. To increase the impact's effectiveness, we need to create preliminary tissue tension. By using tension, we gain much better access to the deep muscle layers of the lower back. Let's break down in detail how to properly prepare the patient for this manipulation. It is crucial for us to stretch the muscle groups located in this lateral part of the back. By moving the patient's leg to the side, we are already setting the necessary initial muscle tension. To open up the zone as much as possible, the working leg should be positioned under the other limb. I cross the top leg over the bottom one and let them hang off the table, securely fixing the patient's shins. I stabilize the patient's pelvis with my hand, ensuring a clean stretch specifically in the lumbar segment. The lower limb now hangs freely off the table, braced by its side edge. The top leg acts as an extra weight, preventing the limbs from returning to their original position. As a result, a pronounced curve is formed, providing an excellent stretch for the lateral line of the body. We achieve high-quality eccentric loading on all lumbar and lateral muscles. To enhance the effect, the patient's arm can also be placed behind their head. This position fully opens access to the muscles, making them as accessible as possible for treatment. Now it is convenient to perform deep finger compressions from the lower rib cage to the pelvic bone. Systematically work the entire quadratus lumborum in this functionally stretched state. You can also add stripping passes directed from the midline to the periphery. Such maneuvers significantly increase the overall effectiveness of deep core muscle treatment. This is not just a technical trick, but a conscious which allows for treating muscle layers with maximum efficiency. Return the patient to the starting position. We have completed the main stage of detailed work on the lumbar and lower thoracic regions. Identified knots on both sides were either completely eliminated or significantly reduced. Perform a stroke and move to the head. Perform a broad, unifying, smoothing stroke over the entire back surface. The next focus of our attention is the upper segment of the thoracic region. Visually, we use the inferior angles of the scapulae as a guide. In this zone, we observe the natural transition and the beginning of physiological thoracic kyphosis. Up to this point, our focus was concentrated on deep treatment up to this conventional boundary. Now we are concentrating our efforts on the section from the kyphosis line to the upper trapezius. After stroking, position your fingers in a V shape and begin the manipulations. Perform a series of simultaneous short strippings on both sides of the spinal column. We steadily work along the entire line of the spinal extensor muscles. The movement should cover the full length of the extensors in this segment. Finish this pass with a long stripping and a general soothing stroke. The interscapular zone is unique because muscles with different fiber directions overlap here. The fibers of the thoracic extensors are oriented vertically along the spine. At the same time, the rhomboid muscle bundles run diagonally, from the vertebrae to the medial border of the scapula. Therefore, our stripping movements must follow these two vectors. We proceed to the deep treatment of these muscle groups. To ensure maximum depth of tissue, use your thumb reinforced by the palm of the other hand. Five to 6 repetitions will be enough for a quality result. Perform a stroke and move to the other side. Again, set the thumb, reinforce it with palm pressure, and perform a stripping movement. Ensure that the stripping movement remains smooth and continuous. Finish with a local smoothing of the treated area. Now we move to focused work on the rhomboid muscles. Begin the movement approximately at the level of the middle of the medial border of the scapula. If the strength of one finger is insufficient, perform synchronized stripping with both thumbs. A third option is to use the thumb with firm palm reinforcement. Reach the bony edge of the scapula, but do not go onto the bone itself. Pressure on the scapula will only cause painful slipping and bring no therapeutic benefit. Press into the edge of the scapula and return to the spine, making short stripping passes. This technique literally forces the spasmed muscles to release under your hands. Problems often arise in the edge zone of the trapezius, which can snap under the fingers. Remember, do not work across this edge during deep pressure. If your goal is to work this area, move strictly along the fiber direction. Place your finger on the muscle edge and perform deep longitudinal compression. This allows for the most effective treatment of the trapezius edge without unnecessary pain. What should you strictly avoid? Sudden deep stripping with a snap off the muscle edge. This is ineffective, irritates nerve endings, and causes an unnecessary defensive response. Instead of benefit, such a technique only brings unjustified pain. Finish the stage with stroking. Perform a broad smoothing stroke covering the entire surface of the scapula. Repeat the entire cycle of manipulations on the opposite side of the back. On this side, I tactily identify much more pronounced spasms in the tissues. Therefore, we will perform a more detailed and deep decompression here. Apply pinpoint compression. Having localized the spasm zone, we target it directly. Fix the pressure on the trigger point. Maintain stable pressure for some time. Under stable pressure, the muscle begins to relax, allowing fingers to sink deeper without shifting. We also observe a clear spasm in the thoracic extensors. Starting from this level, we conduct deep treatment upward. Slowly advance to the upper segments of the thoracic region. Finish the power block with a soothing stroke. Begin the preliminary preparation of the upper trapezius. Thoroughly work the C7 vertebra area. This is our preparatory stage before working on the neck. After finishing this zone, we smoothly shift toward one of the shoulder blades. The transition to the shoulder joint is made through a deep stripping movement. Position yourself opposite the table corner and the patient's shoulder, starting the stripping along the muscle fibers. One hand is directed from the shoulder to the lower back and the second toward the cervical region. Perform a series of deep and confident strippings. Stripping toward the midline of the back is performed at an angle of about 45 degrees. This body position allows for the most convenient impact on the tissues. Perform stripping of the upper trapezius from shoulder to neck using the corner or edge of the palm. In this moment, I apply pressure primarily through my own body weight. Put your body mass into it smoothly, transferring weight from one leg to the other for stable force. The second variation of this technique includes shoulder joint articulation. Grasp the work zone with both hands. The upper hand presses the trapezius from neck to shoulder. At the same time, use the lower hand to press the scapula in a downward direction. With one hand, the second hand simultaneously impacts the attachment area of the latissimus dorsi. Finish this cycle of techniques with a soft, soothing stroke. Spasmed infraspinatus muscles are often found on the scapula itself, requiring attention. For their initial mobilization, I use a soft fist stripping technique. Target the borders of the scapula, avoiding strong pressure directly on the bony protrusions. Try to direct all the effort specifically to the muscular part of the scapular area. After the fist stripping, perform a stroke and add thumb compression. In this specific case, I tactily feel a fairly pronounced muscle knot. To open and stretch this muscle for deeper work, move the patient's arm to the side. This position allows us to perform the highest quality and deepest tissue decompression. Begin the movement from the shoulder joint and lead it along the muscle fibers of the scapula. You can use alternating finger stripping or apply the heel of the palm. Using the heel of the palm provides a firm support and uniform pressure distribution. Position your hand to create the necessary compression and perform a smooth downward stripping movement. You can also further work on the infraspinatus muscles and the latissimus dorsi attachment sites. To do this, we gently bring the patient's arm forward. Place the arm on the table or hold it mid-air, focusing on the latissimus dorsi attachment zone. Place your palm and, leaning your torso forward, perform a deep power stripping. The first option is convenient to perform on a bent arm, which significantly saves your physical energy. The second option is performed on a straight arm, providing a very firm anchor in the work zone. By transferring your body weight into your hand, you create the most powerful and effective stripping. You should slightly pull the patient's arm toward yourself during the pass. The forward movement acts as deep stripping, while the return movement is a soft, smoothing stroke. If the palm area isn't enough for a tough, not engage your thumb. Pinpoint thumb use allows for much deeper tissue compression. Put your body weight into the working hand, preparing it for a power glide. Make a slow gliding movement without sudden slips or loss of contact density. Apply significant pressure in the scapular area, but reduce it when moving onto the ribs. The hand should pass softly over the intercostal spaces without deep, forceful impact. All compression force should be concentrated solely on the scapula and the shoulder segment. Pay special attention to the armpit following safety guidelines. There are many lymph nodes in the armpit area, so we exclude deep pressure there. We only work along the armpit borders where the main muscle bundles are located. Upon detecting a local spasm, perform pinpoint compression to deactivate it. This technique of pinpoint trigger point impact is called myopressure. Finish the manipulations in this area with a soothing stroke. You can perform a series of light vibrational shakes to relax the muscles. After fully working the scapular zone, we smoothly move our hands to the shoulder. Next, our route will go through the shoulder joint to the triceps and the entire arm surface. Move closer to the center of the massage table for convenience in performing the next techniques. We begin performing stripping passes in a reverse descending direction. Stripping is done with the full palm, which firmly wraps around the shoulder as it enters the area. For a quality shoulder massage, your fingers should reach deep under the shoulder joint. This will ensure full control over all muscle groups in this area. Use your second hand to support and fix the patient's limb. First, we perform a shoulder pullback using our own body mass. Securely grasp the patient's arm and synchronize your movements with the weight shift. The movement is performed by the therapist, shifting from the front supporting leg to the back one. This technique effectively stretches the pectoralis major and the upper trapezius. Next, we apply the beak-like grip technique for deep kneading. We grasp the shoulder segment simultaneously from the neck side and the humerus side. We perform rhythmic rolls similar to the movements we previously used in the leg massage. If a classic grip is awkward, you can lift the shoulder with one hand and secure it firmly. The second hand is placed on top, and we perform a deep beak-like tissue grip. We make circular movements, repeating them in one spot for quality treatment of the shoulder zone. When working with a large shoulder girdle where finger strength might not be enough, we change tactics. In that case, it's better to place the patient's arm on the table and switch to the fist technique. We perform deep and confident stripping of the entire shoulder area with the surface of the fists. Then you can switch to alternating thumb pad strippings for more precise impact. We finish the local cycle with stroking and assess the patient's muscle mass volume. If the shoulders are very bulky and athletic, it's advisable to use the forearm for effective treatment. Using our own body weight, we perform deep stripping passes with the flat of the forearm. After working with the shoulder and trapezius, we smoothly transition to massaging the entire arm. The current limb position is ideal for detailed work on the triceps. We begin the impact with broad stripping movements using the entire palm surface. Then we move to more intensive stripping using a soft fist. Mentally divide the work zone into 3 lines: central, outer, and inner. We go through each line, sequentially starting with the upper and outer sides. Pay special attention to the inner surface as the skin here is the thinnest and most sensitive. Work in this area with extreme care, strictly dosing your pressure force. It's important to control the degree of tissue tension so as not to cause the client discomfort. When compressing the central part, make sure the triceps muscle doesn't slip sharply to the side. Such sudden shifts under hand pressure can be quite painful for the patient. Next, we perform a beak-like grip on the triceps, combining it with soft tissue tension. Hands shouldn't just move toward each other, but perform a light upward diverting maneuver. We perform smooth, semicircular movements, maintaining the depth and rhythm of the beak-like grip. After stroking, we move to the biceps, gently lifting the arm from below the shoulder. Stabilize the patient's arm with your far hand. With your near hand, begin performing rhythmic spiral movements in the biceps area. We steadily advance along the entire muscle, ensuring quality tissue warm-up. Then we perform a direct biceps stripping, grasp the muscle firmly and pull it toward you. Repeat the grip, focusing primarily on tissue tension with the index finger. You can also use alternating stretching movements, smoothly transitioning to the forearm area. Lead the movement all the way to the wrist joint. The forearm usually requires more intensive work compared to the back of the arm. The back of the arm is a fairly sensitive area, so work here is always done delicately. Forearm muscles are less painful, but are often very tight and spasmed. Perform a firm grip and begin circular kneading movements. Support the patient's limbs securely with one hand. The second hand performs deep circular rotations along the outer surface of the forearm. Gradually shift closer to the elbow crease for a full treatment of the segment. If the client's physiology and arm position allow, place it palm side up on the table. This fully opens the outer forearm for deep stripping with soft fists. This area can also be effectively worked with the heel of your palm. Be careful in the elbow joint area to avoid injuring it against the table surface. Always consider the individual degree of arm extension at the elbow joint. Continue the detailed tissue treatment using finger stripping. Short focus strippings should alternate with long unifying passes. Finish working the outer side with a gentle stroke. Move to the inner forearm, comfortably positioning the patient's arm on the table. Begin stripping from the elbow to the wrist along the midline, deeply kneading the muscles. Smoothly reach the wrist joint area. If necessary, you can repeat the movement in the opposite direction. To achieve maximum effect on tight muscles, use soft fist stripping. Fix the patient's palm with one hand and perform power passes with the other. Remember, do not go over the elbow joint itself and do not apply fist pressure to it. For significant muscle mass, the forearm can be worked with your own forearm. Perform a deep compression along the full length of the patient's forearm. It is worth noting that the forearm technique is rarely used on the back of the arm. This is permissible only in exceptional cases of very large arm muscles. Complete the comprehensive limb treatment with a final stroke of the entire arm. Perform a smooth, unifying stroke from the fingertips to the shoulder joint. To fully work the arm, attention must also be paid to the palm and fingers. For convenience, we begin work from this side, treating the base of the patient's palm. We perform sequential stripping along each palm bone toward the fingers. Thoroughly and deeply work the entire surface of the palm base. We pay special attention to detailed kneading of the thumb area. Perform a local soothing stroke of the treated area. Through soft stroking, we smoothly return to the upper back for general passes. Now we move to working on the second shoulder joint and arm. We transition through gliding strippings, positioning ourselves directly opposite the patient's shoulder. Conduct a series of preparatory stripping passes over the entire work zone surface. From this position, it is very convenient to perform additional work on the upper back. If the upper back muscle is clearly tight, perform strippings from the shoulder toward the neck. This impact is effectively performed with the therapist's heel of the palm. Begin treating the muscles in the shoulder blade area, considering possible tension zones. Working on the muscles between the shoulder blades, some hidden trigger points may go unnoticed. However, when applying impact from this side of the shoulder blade, new areas of muscle spasm are often found. We find areas of tightness that were not accessible for deep palpation before. Upon finding such a point, fix your finger firmly on it to perform pressure-based release. To increase pressure, you can place a second finger on top and pause until the tissue relaxes. You can also reinforce the working finger's impact by pressing it with the heel of your palm. Complete local work on the shoulder blade area with a gentle, smoothing stroke. At this moment, I don't feel any pronounced. Therefore, additional work with arm abduction and tension is not required here. Smoothly transition to the shoulder segment massage. Move to the middle of the table and perform an upward stripping from the lower back to the shoulder. Securely grasp the shoulder fixate and begin performing deep circular movements. This position is also ideal for performing a functional shoulder stretch. Secure the grip and smoothly lean your torso back using your body weight for the stretch. This way we set the tension for the shoulder area using the strength of both hands if necessary. Having finished with the shoulder joint, we move to the detailed treatment of the three-headed muscle on the back of the arm. We perform sequential strippings first along the center line of this arm muscle, then along the upper one. We pay special attention to the inner surface of the arm, working here as delicately and softly as possible. After stroking the back arm muscle, we smoothly transition to treating the muscle groups of the forearm. It is worth noting the technique for working in the elbow area separately. This area can and should be treated further, focusing on the soft tissues. With our fingertips, we work in detail on the lower attachment points of the muscle tendons. If there's significant tension in the back arm muscle, we target specifically the attachment points of the muscle fibers to the corresponding bone structures. Remember that when the arm is turned, its inner surface becomes extremely. In this zone, muscle attachments are clearly felt and can be quite painful to the touch. It's important to use moderate force here, avoiding excessive tissue compression. Using medium pressure intensity, we perform deep strippings along the fiber flow toward the elbow. We proceed to systematically work the outer surface of the forearm and the wrist joint. Next, we shift to the inner side of the limb to continue the manual treatment. If upward movements on the arm are awkward, you may temporarily change your position at the table. In this case, it's allowed to perform strippings in a downward direction from the elbow to the wrist. This technique is justified provided there's good muscle tone and no abnormal swelling. With normal fluid flow and no stagnation, you can safely work from top to bottom. However, if there's significant swelling, the massage is performed strictly. Since there's no fluid stagnation in the tissues in this case, we continue working in a convenient direction. The absence of fluid buildup allows us to freely vary the direction and range of the stripping passes. We spend time on the mandatory detailed treatment of all the wrist joint structures. Now we move directly to massaging the palm of the patient's hand. We smoothly pass along the spaces between the bones, following the projection of each finger bone. Often there's significant muscle tension in the area at the base of the thumb. Perform deep pinpoint pressure on the thumb base muscles and hold the pressure for some time. Static pressure in this zone perfectly relieves accumulated tension and fatigue. We finish working on this segment with a soft and soothing stroke of the entire hand. As part of the deep muscle massage technique, we can always supplement the procedure with special moves. To do this, we alternate classic stroking with intensive deep fist stripping. After stroking, we can again go over the main group of back arm muscles using our fists. After 2 or 3 such passes, we return to smoothing. With this, the main part of the back massage is complete.
И повторили заглаживание.
To ensure maximum client comfort before working the upper zone, I cover the lower back.
Когда я начинаю работать только уже
This is necessary so the person doesn't get cold while we focus on the neck and shoulder area. We proceed to work on the last and most critical area that clients complain about most often.
остался последний участок. Самый такой
This is the upper back and the large upper back muscle, an area requiring special attention and skill. We use the top of the shoulder blade and the line of muscle attachment to the neck as a visual guide. This results in a triangular-shaped work area. Here we will treat the entire surface of the upper back muscle. In this zone, it's necessary to place a very strong emphasis to achieve high-quality relaxation. We begin the impact with preparatory fist kneading, performing soft circular movements. This manipulation perfectly prepares the muscle fibers for subsequent deep treatment. After thoroughly kneading the tissues, we move to alternating longitudinal strippings. Place your fingers near the spine at the muscle attachment points and lead them toward the corner of the shoulder blade. Smoothly press the tissues and draw a deep line toward the shoulder blade bone. Pause slightly at the end point. We are literally pressing and stretching the shortened muscles. Often clients come in with shoulders habitually raised and shoulder blades pulled upward. In this state, the muscles are constantly shortened, causing tension and discomfort. That's why such focused work is done here, first on the top layer, the upper back muscle. Deeper down, we impact the small muscles between the shoulder blades and the upper sawtooth muscle, stretching them. Deeply press the selected segment and perform intensive stripping in an outward direction. Techniques can be done in a lighter form, working with fingers alternately or simultaneously. There's also an option to use the inner line of the palm for a more powerful impact. Press with your finger at the starting point and perform a deep stripping to the side. In this technique, we effectively treat the upper back muscle through deep compression. As you can see, this position allows me to put as much of my body weight as possible into this movement. Place your thumb at the edge of the spine and transfer your body weight onto it. Perform a steady stripping motion toward the shoulder, engaging your whole body rather than just hand strength. Finish the pass with a smoothing stroke and move to a modified technique for working with a large muscle mass. If you have an athletic client, you can safely use your forearm for the stripping. When working with the forearm, it is critical not to go over the bony ridges of the spine. Also be careful when approaching the shoulder blade to avoid painful pressure on them. Secure the arm, create the necessary pressure, and smoothly shift the tissues to the side. Using the forearm allows me to effectively put my weight into a deep stripping movement. Thanks to this technique, a therapist of any build can easily work through a large muscle mass. The main thing is to maintain ergonomics and properly direct your body pressure into the work surface. Constantly control the force vector, transferring it from your torso through the forearm to the client's tissues. If the muscles are extremely stiff and won't soften, stay static on one point. Hold the pressure for 10 to 15 seconds to help the fibers relax reflexively. This tactic effectively releases the area from the shoulder blade to the neck in any difficult case. After thoroughly working the upper part of the back muscle, perform a stroke and move to the other side. On the opposite side, we repeat the process, starting with alternating finger strippings. Then move to more intensive simultaneous stripping of the tissues with 2 fingers. Painful knots are quite often found where the muscles attach to the bone structures. I will show you once again the deep impact technique we call deep pressure therapy. The essence of the technique is targeted impact on the discovered muscle tightness. To remove the knot, we firmly press the muscle with a finger against the bone base and hold it. Under steady pressure, the tense area begins to relax gradually and predictably. This is a basic physical reaction of muscle tissue to deep pressure compression. You will feel the relaxation tactilely. The finger will begin to sink slowly deeper into the tissues. The previously tight muscle bundle loses its density and changes its mechanical state. The hard knot under your hands literally begins to melt, becoming soft and pliable. Under your pressure, the finger shifts on its own, which signals that the trigger point has been cleared. The greatest number of such trigger zones is located precisely in the area between the shoulder blades. They are especially common right at the points where the muscles attach to the shoulder blade. Finish the power block with a soothing stroke and a high-quality deep stripping. To perform the most effective stripping, set up your ergonomics correctly. Position yourself level with the client, so the force vector goes from your torso into the work zone. In this position, you can deeply work the upper part of the back muscle without extra effort. If you have a client with a large pronounced back muscle mass, you can apply the same principle as when kneading the muscles between the shoulder blades. Place your forearm at the base of the neck and perform a deep stripping toward the shoulder joint. The movement should be smooth and directed strictly toward the shoulder. I will show another way to work with the forearm for maximum strength, deep yet safe. For this, we correctly set up the pressure lever by placing the arm on a support. The working arm must at this moment place your elbow on the table, secure the shoulder with your hand, and firmly grasp the back muscle. Then use your other hand to gently push the working arm to the side, creating a powerful pressure lever. To repeat, elbow on the table, hand firmly pressed to the back muscle at the base of the neck. With the second hand, you apply pressure to your working arm, increasing the impact. At the same time, the main working arm barely expends any energy. All the pressure comes from the supporting hand. This stripping technique is available to any therapist regardless of their own build. This is the ideal way to work through a large volume of muscles. On the opposite side, we perform the exact same impact, maintaining ergonomics. With the free hand, we gently press on the working forearm, deepening the contact. If the back muscle is very tight, you can stay on the point of maximum tension. It is important to avoid sudden sliding of the hand over the bony parts of the shoulder blade or shoulder. Your stripping must be controlled deep and passed strictly over the soft tissues. This will ensure the client's comfort even under very strong mechanics. To work the deep muscle layers when there is a significant volume of tissue, use the following technique. First, perform a deep vertical compression of the selected muscle section. After sinking into the tissues, make a light shift to the side, creating tension and weight. We don't necessarily have to perform a stripping over the entire length. Pressing a specific trigger is enough. For the most effective relaxation, we add a little stretch to the compression. Shift literally a few millimeters to the side, stretching the tight fiber under your fingers. This is the most effective way to quickly and effectively remove a muscle knot of any complexity. Regular static pressure is effective, but combining it with tension works even better. After pressing the point and adding a micro shift to the side, we wait for the tissue's response. Today, this is the most effective method for deactivating painful trigger points. We can also perform a deep stripping in the area of the large bone at the base of the neck. Lock your hands together directly over the prominent bone at the base of your neck. Make soft circular rotations with your palms on both sides of the bony ridge of the spine. Try not to squeeze your hands too hard. Use the natural leverage of your palms. Just lower your hands onto the tissues, and you will feel enough pressure being created. Now perform circular movements using your body weight to impact the deep tissues. The full concentration of the movement is now on the outer side of the base of your palm. I only use this specific part of the hand for this neck manipulation. In other stripping techniques, this corner of the palm is rarely used. Frequent use of this bony part of the hand can lead to injury of your own hand. This kind of work can cause pain in the therapist's joints, so be careful. I apply this technique exclusively for local work in the neck area. After thoroughly warming the area around the base of the neck, we move directly to the neck massage. Remember, neck massage is always performed with only moderate medium pressure. Deep or sudden pressure in this area is strictly forbidden due to the proximity of blood vessels. Important veins, arteries, and nerves pass just to the side of the midline. We work only on the back muscles of the neck, staying off the sides. Place your fingers on both sides of the spine and perform short circular rotations. We steadily work the full length of the neck up to the base of the head. Repeat this pass 3 to 4 times for quality muscle relaxation. For better stability and to save energy, you can interlock your thumbs. This allows you to perform circular movements without extra strain on your hands. You can also perform similar manipulations using just the pads of your thumbs. Make gentle circular movements focusing on the tight areas. Move strictly along the muscle ridges following the set path. The third technique I often use is a soft beak-like grip on the neck. Work only on the upper muscle mass without squeezing the neck too hard. Excessive pressure on neck vessels can cause a spike in the. Avoid deep work on the sides, focus only on the back line of the neck. Finish this stage with a smooth, soothing stroke. Now we fully cover the patient's back with a sheet or towel. After the full back is done, we have the final stage, the head massage. Place 4 fingers at the base of the skull, where the bony part of the back of the head begins. You will easily find this line. This is where the neck and back muscles attach. All these muscle groups are connected and fixed to the bone at the back of the head. Proper technique is vital in head massage to avoid causing discomfort. Avoid chaotic movements that might tangle the client's hair. Fix your fingers in one spot, pressing the scalp firmly against the skull. Only after this secure fix do we begin slow rotations. Fingers shouldn't slide over hair. The scalp should move over the bone under your pressure. I can clearly feel the base of the skull and the attachment points of the muscles. I am working them in detail, now focusing on the deep muscle structures. Pressure here should be medium. Light touches won't be enough for quality work. The force should be enough to clearly feel. You should feel the soft tissues being pressed firmly to the bone structure. After about 10 reps, slowly release and move up about an inch. Fix your fingers again and start shifting the tissue, maintaining steady, firm contact. Note all rotations come from my body weight, not hand strength. I don't use hand power, fingers only stay tight enough to hold the position. I transform light torso leans into a gentle massage on the scalp. After finishing the current segment, we smoothly move to the next area. Tip: if your hands are too far from your body, they are harder to control. Distance makes the work less ergonomic and reduces the accuracy of deep moves. Bring your elbows closer to your torso to shorten the reach to the head. This gives you perfect control and a secure grip for your hands. Working the top of the head with 4 fingers at once is not always easy or correct. So I switch my grip and place the pads of my thumbs on the highest point of the head. I perform soft circular rotations, deeply working the connective tissue of the skull. The next stage includes softer, relaxing manual movements. Cup the head and perform rotations where the hair can slide slightly. We reduce pressure and move to light, calming massage passes. Clients often have headaches caused by strong muscle tension. In such cases, 4 fingers might not be enough for the back of the head. I rest my palms on the headrest for stability and place my thumbs on problem spots. This lets me use the full power of my hands on specific areas at the back of the head. My thumbs create much more intense pressure, ensuring a deep therapeutic effect. Sometimes head tension is harder to clear than the back muscles. Working the soft tissues of the head is a vital stage of the full massage. Finish the head area with a soft, soothing stroke. To end the massage of the back side, we perform light tapping. As you move down to the lower back, the intensity of these movements should gradually decrease. The tapping technique can be done using a fan-like finger position. The edge of the palm hits first, then each finger follows one by one. Keep your hands as relaxed as possible so the hits are soft and rhythmic. One swing of the hand turns into a series of 4 small taps. The main part of the back of the body massage is now complete. We have worked the full back line as the foundation for the general massage. Next, the client flips over and we start the front side. We will begin at the legs and move sequentially up to the stomach area. Stomach massage is optional. Always ask the client before starting this stage. I recommend always checking with the client regarding the need for stomach work before starting. Then we move to the chest, focusing on a deep treatment of the upper chest area. Finally, we return to the neck, including work on the large muscles on the side of the neck.